We were overwhelmed by the outpouring of love and support. I did not know that many people in our community cared about healthcare workers and what we did every day. Overwhelmed the first several months. We never had to buy our team members snacks, lunches, dinners, meals. Our community stepped up and really provided that. Probably one of the most awesome things, I think, was they did I think they called it Park and Pray, where they all made signs and were out in front of our facility and were honking horns and flashing their lights, and just really supportive of our team members. We all still have signs, I think, hanging in our offices and on the hallways that came from that event that night. Being in leadership, I was very proud that our organization chose to support our team members because they were struggling. One of the things that we did here at Prattville for our nursing leaders is we realized very, very quickly the anxiety, then the fatigue. They were working because we had so many patients coming in. Even our leaders were taking patients. Everybody in this building had scrubs on and was taking patients if they needed to. Employees were scared for their own health, taking it home to their families as well. So from a nursing standpoint, we worked with a company called Innovative Connections, and we did a lot of resiliency training. That was a huge investment for Baptist Health, and it was only an hour a week. It seems like a really short time, but it made a tremendous difference. It gave our leaders a time to really bond, get away from their staff for just a little while, and then actually open up and talk about, hey, what am I really feeling right now? What's going on? Kind of a debriefing session with coaches that were able to talk us through all the feelings we were having. It was very impactful.
We've said many times that if we would have done a tabletop exercise about COVID a year before COVID hit, we would have said that what healthcare did was not possible. But yet we did it, and we did it day after day after day, and our team rose to the occasion. And so when I think about the creativity and the capacity of that team and what they could accomplish is far beyond what any of us, them included, would have ever thought possible. And so that does change the way you think. The things that our team did, heroic measures, and continue to do today, I just couldn't be prouder of them, and I couldn't be prouder of our community. We still have people reaching out saying, we hadn't forgotten what you guys are doing, and what can we do more, and just tremendous gratitude for all of that.
I enjoy doing what I'm doing. Truly try to make a difference in not only the patient lives, but in the lives of my team members every day, because without them, we could not do what we do. So in that respect, just happy to be here to contribute those things that we can contribute and make the place a safe place.
We have an amazing support system here at Prattville as far as respiratory goes. If we ever needed anything, they were there. We never wanted for anything. We saw a lot of death. We saw people get well that we never thought would get well. The biggest thing for me was one of our first patients we got off the vent, putting the speaking valve on his trach, and his first words were "thank you." Rather than to tell his wife he loves her, he thanked us, which was amazing because a lot of people don't realize, that we see the people from the beginning to the end. They don't leave the unit and we forget about them. We still follow them everywhere.
Before COVID, we would just order stuff and it would just be there the next day or within a few days. And with COVID, it was such a mass. Everybody just needed it all of a sudden that it just wasn't there. So you would scrounge to make sure that you had the stuff, and we got to the point where we weren't just ordering and expecting it, we were ordering and hoping that it would come in. And if it didn't come in, then we would email and say, hey, I need this, 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 and this. And with all three facilities and with the PPE warehouse now, it did help a lot that we all worked together to make sure that we all had everything we needed.
It was really a teamwork because you're in a room, you're all dressed up. You can't just keep undressing and running out. And all you have to do is holler out the door, hey, I need this, I need that, and it's there. Our unit back there has always been really good, but it really came together a lot better It was bad when no visitors were allowed in the hospital and you were all they had. They're scared, you stand there, you hold their hand, you pray with them, you sing to them, you talk to them. You do what you do.
Thankful every day for the smallest things, you know, being able to get up, being able to, for your children to go to school again, being able to come to work, not to worry so much about the what ifs. You know, you can't buy compassion, and so it has to be within you to do what we do.